62% of all personal bankruptcies were a result of medical expenses, according to a recent Harvard study. 72% of those who filed for bankruptcy due to medical expenses even had health insurance. Currently, the number one source of debt collections is medical debt, according to Stanford University. My name is Dan Flug. I live in Easton. My family has been impacted by the exorbitant cost of healthcare. 10 years ago, my wife was diagnosed with multiple sclerosis. For those who are not familiar with MS, it is a neurodegenerative autoimmune disease. Basically, your immune system starts attacking itself. My wife started out with some tingling in her extremities, then it grew into pain in her arms and legs. And in 2017, things started getting bad. She would struggle each morning just to take a shower. Her vision became blurry, and it was difficult for her to care for our newborn son and 2-year-old daughter. At that point, her team of neurologists and doctors recommended a medical treatment that showed success in others with a similar MS profile. The doctors gave us some hope, and we were excited. And then we were notified that the claim was denied by our health insurer, Anthem Blue Cross Blue Shield. I told my wife to worry about her own health and take care of her body, and that I would worry about figuring out how to pay for the treatment. We appealed the denial by the insurance company. We requested a peer-to-peer review. It was skipped by Anthem, even though it was required under Connecticut general statutes. We enlisted the help of the Connecticut Office of the Healthcare Advocate, the OHA, who are a great resource to policyholders. But ultimately, our appeal was denied as well. Because of the insurance denial, I ended up having this $125,000 medical bill spread across 7 or 8 different credit cards. I'm here to tell you firsthand, when you have a spouse suffering, the last thing you need is the weight of this financial stress and what felt like a David versus Goliath fight with an insurance company. My story is not really unique at all. All you need to do is look on GoFundMe, and you'll see many similar stories. Families here in Connecticut see the rise in healthcare prices hitting them on a daily basis. One common problem, which isn't widely discussed, is that coverage of claims that were just copays in the past are now shifted over to the deductible instead. For example, an ER visit or a childbirth claim under my insurance plan used to be a $250 copay. However, a few years ago, ER and childbirth claims became part of the deductible, which in my case is $2,500 per individual. An example of the unfortunate knock-on effect that this might have is you might have a guy wake up in the middle of the night with chest pains. He might be unsure if it's a heart attack. And because he knows just walking through the door of the ER and getting an EKG could cost him $2,000 out of pocket, he might actually delay life-saving treatment so he can go to a cheaper urgent care facility or doctor in the morning instead. Another problem popping up are the surprise medical bills. Just an example, we got blood work from one provider one year and it was fully covered by insurance. The next year we went back to the provider for the same blood work and we got hit with a $1,200 out-of-pocket facility fee. I know as a consumer, I see the direct impact of nickel and diming from my health insurer, where I have a high deductible plan, even though my premiums cost my family $33,800 per year. But I'm sure there's blame to go around on the high cost of healthcare to Big Pharma and their 40 lobbyists in Hartford. And there's also blame shared by the providers and the hospitals, which are undergoing consolidation and they're commanding higher prices for their services as market power increases. I understand we live in a capitalistic society, but in order for capitalism to work, we need laws which are fair to the consumers, and corporations need to play by those rules. Insurance is supposed to act like a safety net for its consumers, but instead it's acting like a money train for executives. Please help the people of Connecticut.
Thank you, Dan, for sharing your family's personal story.